During the cross-border health meeting, the Congolese health officials commended the Ugandan health system for managing plague, seeking for support and knowledge on best means to manage the virus. Dr. Cleophas Ntumba, the health officer for Biringi Health District, says his area alone from 2021 to 2023 registered 321 cases of plague with 6 cases of death reported. Pascal Olama, an analyst from Ituri province, said the meeting will help them respond to outbreak and management of plague and improve their knowledge.
Nous avons des populations de part et d'autre de la frontière.
We have population both sides of the border.
Et les populations se fréquentent.
And those populations, they go through the border.
C'est comme ça que de telles rencontres sont très importantes pour connaître nos différentes visions dans le cadre de la lutte.
That's why such a meeting are very important in order to know what should be done in the future.
Nous sommes très contents, très ravis pour que nous puissions connaître aussi comment l'Ouganda est en train de lutter contre la peste.
We are really happy and grateful, and we would know how Uganda is doing in order to control plague.
Linda Atiku, the program manager, UVRI Arua Regional Center, says the laboratory in Arua can handle over 100 tests in a day, and this will ease tests for DR Congo.
One of the objectives that we had was we wanted to really understand the health systems on both sides, so that we are able to know how to collaboratively work together, be it working together in following up cases into the two countries, or be it diagnostics. So we have come here to put heads together to see how this can be done. But the plague laboratory actually has the capacity to test samples that can even come from other neighboring countries, because it has been upgraded, and one of the reasons that it was upgraded is the fact that it is strategically located to serve both the DRC and then Southern Sudan.
Dr. Tom Lutalo, the Assistant Director, Uganda Virus Research Institute, says the meeting is to promote collaboration on ground surveillance.
Not only shall we have come up with established systems that involve both the DRC partners. You know very well that now we have directors of health services from both DRC and Uganda. And I realized that everybody is coming up with this idea that it has taken long. We should have had these partnerships a long time ago. We've been hearing that there are plague cases in Congo, but the surveillance on the ground, the capacity to test, is not there. So that's why we've mentioned that our laboratory, actually the capacity, it was improved recently, and we hope that the partnerships that are going to be established during this meeting will have systems of shipping samples to our laboratory. It is very helpful if at all you have such laboratories in place. Otherwise, going by symptoms, you may not know what actually is the disease.
Alfred Okwanzi, the LC5 chairman, Arua, calls for increase in surveillance and awareness, calling for benchmarking to ensure the two states handle the virus with proper management.
I am happy the public health importance of plague is the case fatality.
Je suis très content que le personnel de santé qui est ici,
it has very high case fatality.
Ça a une très haute fatalité.
And therefore anything that threatens our health, we have all the reasons to come together and address it.
Pour
not
tout
been
problème,
experiencing.
Il y a 10 ans passés, nous n'avons pas été en contact avec ça.
It is possible that the threats from DRC and also elsewhere and our porous borders requires us to sit and put our heads together how we are going to detect this and prevent it.
Dr. John Opolot, the Assistant Commissioner from Ministry of Health Uganda in charge of veterinary public health and zoonosis, says the cross-border meeting is important because plague is a zoonotic disease with the majority of cases coming from Congo.
you find that when we don't allocate resources for surveillance activities, these zoonotic diseases, because they don't occur only in the human, they can also, they are sometimes in the animal side. So with the zoonotic diseases, you might find that as the disease is not seen in the human being, it might be now developing in the animal side. So we need the resources all the time to do surveillance across all these sectors.
Uganda has managed to control plague with the last case reported in 2019. Robert Ariaka reporting for Urban News in Arua, West Nile region.